We want to give you a little bit of an update about what data is available on our website, what resources are there, and sorry about that. The majority of the time will be spent on giving you the details of the Utah Leads Together phase guidelines, the state health guidance, specifically related to low risk or yellow. And then we'll answer some questions. So our website is daviscountyutah.gov/coronavirus. And on that website, every day, data is updated, so you can always get the most current information, and all of our residents have access to that. We also have our frequently asked questions there, which have recently been updated for yellow. We have yellow guidance documents, posters and signs, and other resources. So we'll just jump over there so I can show you what's there. Let's start with our data dashboard. So you can see our total number of cases, total number of hospitalizations, whoops, sorry about that, total number of tests and number of deaths. Our cases have really slowed down. As you can see in this yellow graph, we peaked and we definitely flattened that curve. And that's thanks to our entire community, all the businesses and everybody working together. We do have, well, let me show you this pie chart right here. The big green area is our exposures. So 64% almost had a known exposure, meaning it was someone in their household, someone in their work site, or another acquaintance. We still have a little bit of travel and then some unknown, but most of our cases are these close contacts, and they probably know the person that they were exposed to. Also, we are doing really great with our testing. Our testing numbers have been high, people are continually getting tested, and we have a really low positivity rate. So only 2.4% of those getting tested are testing positive. And most of our cases are recovering really well and recovering well at home. We do have some hospitalizations though, and so that data is there as well. Some people want to know a little bit more about the current outbreak. And so the phased risk indicators are more what is currently happening over the last 14 days. So active cases of COVID in our community and current hospitalizations, and that's about 4. We had 2 deaths, which is the most severe outcome of this, and those were both back in March. So our community has done an outstanding job really preventing these deaths and protecting those who are most vulnerable. This graph here with the blue bars is one that's really important. You can see that we have 5 consecutive weeks of kind of a plateau. There was even a little dip there in the middle, but overall we've plateaued. And these are some of the measures that are used to help us know if it's time to move to yellow, when it will be time to move to green. It has to do with our cases, but those decisions are also made with an understanding of our hospital capacity, ICU bed capacity, and what type of exposures are in our community, how many of those are unknown. So just so you're aware, that's available all the time. And then we have our map that just kind of shows which zip codes or small areas or cities are experiencing a higher burden of disease. Okay, I'm going to show you the other page of our website where some of those resources are available for you. Right here on our Safe, Smart, Strong, we have frequently asked questions. So those are right there for people who just want to see what's going on and the things that we get asked about very most. Right here in this middle section is the low risk guidance. So we've updated all of our documents to show what it means to be in yellow. Specific industry guidance is right here, this button. And if we click on it, you'll see that retail's on here. Let me see, where's retail? There it is. And there's a quick snapshot of bringing that really hard to read small print Utah Leads document, kind of simplifying it and bring it all into one place for retailers. So this is what Rochelle will go into a little bit more in just a minute. Also, a little bit towards the bottom are our resource downloads. We have all kinds of documents for businesses and links to economic resources and CDC resources. And then Rochelle will talk about some of these self-monitoring guides and sanitation resources. They're all there for you, as well as posters and signs. They're here for you to be able to download and print and use as you wish. If you need us to print some and deliver some, you can reach out to us and we can work to get you what you may need. And then there's other downloads and resources for specific industries here as well. We've also got some mental health and then some testing information. So let us know if there's anything missing from our website that you think would be helpful. But we wanted to know you to know those are all there. So sorry, you guys can probably see that going crazy. We wanted to remind you about how COVID-19 is spread. And you all know this, but it's person to person through respiratory droplets of someone who's infected, especially when they cough or sneeze, but it can happen when people are asymptomatic. And that spreads really likely when people are in close contact with one another. And close contact means closer than 6 feet for 10 minutes or more. And this is really important because we have had plenty of mini outbreaks in work sites. Work sites, in addition to homes, are a key place where this type of close contact happens and where community spread or spread of COVID-19 can happen. And so it's really important that these precautions that we'll be talking about are in place. If people are wearing face coverings, that's going to put them at a much lower risk. Even if they were in close contact, that's considered a lower risk. We've had worksite outbreaks in restaurants and in manufacturing facilities and in healthcare facilities. So we wanted you to be thinking about, it's not if, but when. We did an awesome job of flattening the curve. And so what that means is we're not going to have tons of cases all at one time, but that we're actually spreading those cases out over time, which means we're going to continuously have cases over the next few months and weeks, but just not as many at one time. But you can expect that there will be cases, exposures, outbreaks. And so just be thinking about how you can limit that close contact and what you will do to prepare for absenteeism and continuity of operations if some of your employees do test positive or have to be quarantined. We wanted to just share some of these posters and signs that are available that help line up with the guidelines that we'll be sharing. And then we have other signage related to hand washing and just other best practices to keep employees and patrons protected. Utah Leads 2.0 is the phased guidance for how we work through these phases where we're turning the dial, not just flipping on and off a switch, but the plan is designed to help businesses and individuals balance health and the economy. It's a huge sacrifice for everybody in different ways, and it's trying to balance all those sacrifices and get us moving forward and opening things up. So the task force that put this together is a group of experts from healthcare and all of your industries, just trying to keep all of the factors in mind to keep us moving forward and to respond to the pandemic as it evolves in our community. So overall, yellow going from orange to yellow didn't change a lot for your industries, but overall what it meant for the community is just that precautions are still needed, social distancing is still important, face coverings in public are important when it's difficult to maintain that social distancing or 6 feet, and that gatherings moved from 20 to 50. So these are really private gatherings, family gatherings, where now we still want those to be as small as possible or smaller groups when possible. And the 50 limit doesn't apply to those organized groups. So businesses can have more than 50 people and different organizations can bring together more than 50 people as long as they have a plan in place to ensure social distancing, to know who's attending, and to kind of keep track of things so that if there were an exposure or an outbreak, that it would be easy to contact all those who are most at risk. Still limit out-of-state travel. There's still spread in certain communities. And then symptom checking is really recommended to make sure that employees don't come to work when they're sick. It's surprising how many sick people continue to work and then spread that in their workplace. And also those who are doing close contact sports, that was the change to yellow, is that those are allowed, but just that nobody sick should be participating, so symptom checking there. And then high-risk individuals are still recommended to follow orange guidelines. They just have to be more cautious in every phase because they are greatly impacted by this disease with severe illness, and they're just extremely vulnerable. All of the data is showing that it's important for them to continue to protect themselves. So I'm going to turn things over to Rochelle. She's going to go into a little bit more detail for your industry. Oh, I got to stop sharing, huh, Rochelle? Sorry. Okay, hold on. Sorry. Okay, I cannot see my stop share. I'm really sorry about this. It's nowhere to be found. Okay, here we go.
Okay, perfect. Thank you, Isa.
Sorry.
So that's okay. As Rob already mentioned, my name is Rochelle Blackham, and I am the Environmental Health Director, and I will be going through the Utah Leads guidance. So I am going to start sharing my screen. As you can tell, we're bouncing back and forth because we are social distanced here in our office. Okay, perfect. So first off, I feel like you guys might be the field experts out there, considering you guys have been open this entire time, and maybe you have some good practices that you've implemented that you'd like to share. So I know that's not the reason for the question and answer, but feel free to add a couple points in there if you have something that's working out and you'd like to share with others. And also feel free to ask questions throughout the presentation because Jay will answer those. And of course, we'll have the question and answer at the end as well. So first off, in the Utah Leads Together 2.0 phased guidance, we are currently on version 4.4, which was released on Friday. So we've provided this link here because without fail, this guidance is continually changing and being updated. So we want to give you the link so that you can look for yourselves if the guidance has changed as we move forward. I'm going to be reviewing the general business guideline that's outlined within the document, and it is scattered throughout. So there are multiple pages in which it references general businesses. So we're going to look at a collection of things from pages 2, 5, 10, and 20. And then the retail section is on page 12, and we will get to that at the end for specific just for retail. But right now for general businesses, the first thing is to take reasonable precautions. As Jay and I have been out inspecting facilities or reviewing plans, what we've noticed is that each individual business is different, even if it's within the same industry. So we really feel like it's case by case with everyone, and that you guys have the best idea of how things work and how you can implement these different guidance. So we really want to encourage you guys to adapt and do what works for you. We're going to talk about remote working. We're going to talk about symptom screening. We're going to talk about social distancing, strict hygiene, clean and disinfect, face coverings and or masks, protecting the high-risk individuals, and then other practices, and then we will get into industry specifics. So first off, as a general business, or in general, all businesses should still encourage flexible working arrangements, which does include telework, if possible. I realize in a grocery store or retail setting that doesn't work very well, but this could could mean your curbside pickup and different practices like that. Rotating of shifts. So we do really encourage individuals to maybe not intermingle all of their employees. So maybe you have certain employees that work in the morning and certain employees that work at night, and try to separate them. So if there is an exposure, that you wouldn't have exposed your entire workforce. And we'll kind of get to that as we move through the slides on what an exposure is. So exercise discretion when returning to the work site. So this is interesting, and I'm sure a little comical for you guys, because you guys have been working the entire time, as well as hiring more people to help you, I'm sure, with the workload. What we mean by this, though, is because we've moved from high risk to moderate risk all the way down to low risk, we don't want to just automatically flip the switch and have everyone go back to life as normal. But we are encouraging people to go out to businesses, but use precautions. And we want this to be more of like a dimmer switch. So if there are still areas that you can scale back in your processes or within your business, we're asking you to kind of take baby steps. And of course, use email, conferencing, telephone calls, and different things like that instead of face-to-face meetings if possible. So as we move into symptom screening, monitor employees for symptoms and their well-being. So this is going to differ in the retail areas, particularly within grocery stores. So you should monitor your employee symptoms, and that could be a verbal check. And we'll kind of get into that. But in your food establishment areas, whether you have a restaurant inside your store or you have a deli, you are going to have to do active monitoring where you take temperatures for those employees. And we'll kind of get into that a little bit further. But if an employee develops COVID symptoms while on the job, we're asking you to separate them from other employees as well as customers and ask them to leave the facility immediately. Of course, it makes sense that you would then sanitize their workstation after they've left. We're also asking all businesses to prohibit employees from working who've been instructed to isolate or quarantine by the health department. And we'll kind of get into that a little bit as well. So when you're asked to monitor employees for symptoms, what we're asking you to do, or what symptoms we're asking you to look for, is a fever that is 100.4 or above, a cough, trouble breathing, a sore throat, sudden change in taste or smell, and muscle aches or pain. So we have this document available for employees self-monitoring. It talks about them taking their temperature before they leave their house, before their shift. It tells them what the symptoms are, and kind of goes into whether or not they have been exposed or been in close contact with someone who's sick or is positive. So assessing, for exposures. This document is available on our website if you find it to be helpful. But we've had a lot of questions from everyone asking, what does it mean to do symptom screening? Do we have to record it? Can it be verbal? All those different things. And we're really saying that the method of how it happens is best decided at your facility. Specifically in the food industry, where you may have a deli, that needs to be the facility or deli manager needs to take the temperature reading of each employee at the beginning of each shift. How that's documented or done is up to you. One of the things we want to discourage is everyone using the same clipboard, everyone using the same pen, those types of things. So if it's possible for each person to have a clipboard where they log in each day and take their own temp with a contactless temperature, we obviously want to encourage that. Maybe it can be done electronically, or again, can be done verbally by the manager. The store manager can just ask everyone the questions, and they're the only ones that fill out everything. So going to industry specifics, again, in a restaurant and a gym, they are required to take the employee temperature. Anyone with a fever, as we mentioned, should not be allowed in the establishment or facility. We're recommending that you use any thermometer that's available. So if you have a thermometer that is contactless, that's obviously preferred if it is also for human temperatures. If you just have like the IR or infrared equipment or device, like in food service, that can be used, but just note that when you are taking a forehead temp, that it's actually taking a temperature of a 1-inch radius on the forehead, and those guns, or those, excuse me, those tools are not calibrated for human temperatures, and so the manufacturers have released statements that you can use those devices, but the temperature reading would be 90 degrees to 94 degrees. So just know that if you are using thermometers that are not contactless, so maybe they touch the ear, we're saying that you need a new protector or sanitation sleeve between each individual person. All other industries that are not required, excuse me, to take the temperatures, but to screen employees of the fever can do that verbally, and the employee could do that prior to working before leaving their house. So what does it mean, and what happens if you're exposed to COVID-19? So if someone is exposed, then they may be asked to quarantine for 14 days. Isa mentioned what exposure meant, and that is being closer to somebody who is sick and has tested positive, meaning closer than 6 feet for longer than 10 minutes. If the person does not get sick while they're on quarantine, they still must finish all 14 days. So I know that there's some individuals who have been identified as exposed, and after 5 days, they may get a negative test result, but they still could develop symptoms or become ill up to that 14 days. So they still need to finish out their 14-day quarantine. And of course, if we are going to quarantine someone, we are going to make contact with them and give them directions, as well as give directions to their employer if we are excluding them from work, which I will get into a little bit more. So what if somebody tests positive for COVID-19? If they are test positive, then they should self-isolate to protect others. They can return to work after they're fever-free or their symptoms have improved for at least 3 days. And notice the end, that it has been at least 10 days since they first became sick. Again, so for individuals that have tested positive but have remained asymptomatic or never became sick, they must still self-isolate for 10 days after receiving their positive test result. And again, the health department will help give directions when these people have been identified. I want to get into what it looks like from the Environmental Health Services Division as far as an exclusion letter. So if somebody who works for you becomes sick and they get a positive test result for COVID, those results are automatically reported to the health department. When we do our normal contact tracing, we will contact that individual and ask questions about where they work, who they've been in contact with, what their routine has been for 7 days prior to them becoming ill. If perhaps they identify your facility as an area that they work at, we will contact you and ask for schedules, shift schedules. We will say this individual is positive and we'd like to know everyone that they have worked with in the last 7 days. By the time we get the results, it's actually possibly 10 days, usually is what we're looking at. Then we are going to ask questions of the facility and the individual. Did you wear a mask the entire time? Did you social distance the entire time? Was there any individual that you worked closely in close contact with? Those types of things. And that's going to help us identify individuals who we believe has been exposed, again, which are people who have been in close contact for a lot longer than 10 minutes. And then we are going to issue exclusion letters for those employees. As you can see on the exclusion letter, it does outline how long they are excluded from work until by dates. So, and then on the social distancing, we are recommending all general businesses to social distance. What that means is to maintain a 6-foot distance from others. This could mean staggering workstations. Instead of having, 2 fruit cutters at the same table, we want you to have them at separate tables. The tables are 6 feet apart. They're not facing each other. They're both facing forward, even though the tables are there. It seems silly, but that gives people out of direct contact if someone were, or direct exposure route if someone were to cough or to sneeze, by having them all face one direction. Again, we want to limit employee to employee contact. This could be in your break rooms. This could be in your small workstations, whether that's the meat cutting, it could be the delis, that could be staggering shifts or stations, different areas like that to increase social distancing. Minimize customer interactions and time spent in the facility. That could be promoting curbside pickup. Anyways, and then of course, limit group sizes when possible. Strict hygiene. I feel like you guys are doing really well out there in the retail setting already on this one. I've heard some really great positive stories or best examples out there. So when it comes to strict hygiene, please wash your hands frequently, make hand sanitizer, soap and water, and other disinfectants readily available. Avoid touching your face, cover when you have to cough or sneeze, like into your elbow, best etiquette. Do not shake hands, limit physical contact. When it comes to cleaning and disinfecting, we want you to regularly clean and disinfect the facility as normal, but then we want you to increase your cleaning on high touch surfaces. That could include, toilet handles, doorknobs, light switches, countertops, all of those things. And of course, in the industry specific, it does talk about the carts and baskets being sanitized. Immediately clean and disinfect areas if an employee leaves sick or was at work sick, and disinfect between customers and clients when there's things that they're handling, like the cart and or basket, different things like that. If there is an area or a door that we would really recommend automated doors, which I know a lot of people have. Sometimes in the retail setting, there may be a door where individuals are entering your business, and we would encourage that door to be propped open as much as possible, or have limited contact with it. Maybe an employee opens and closes the door. Again, masks and face coverings are recommended and should be worn by employees and patrons when it's difficult to maintain 6-foot distancing from others. Some of these retail settings are getting packed, if you will, or has a lot of people in it. So obviously we recommend all the employees as well as individuals visiting the facility to wear masks. We do believe that it prevents the spread of the virus from the wearers to others, and we think it's important when it comes to asymptomatic spreading, individuals that don't know that they are sick and yet still have the virus. We believe that wearing a mask is an additional public health measure, but it does not replace social distancing or hand washing. It's just an additive to those things. So we feel like all those should still happen. And then again, clean used face coverings daily. We won't want them to become soiled or dirty. So if they are reusable, please wash them, those types of things. Make sure that your employees or yourself can breathe through the masks, and that you wear them when you're out in the public. You wash them after. A couple don'ts is we do not recommend children under the age of 2 to wear the masks, or individuals who cannot take on and take off the masks themselves, or if you have difficulty breathing, those types of things. And then obviously healthcare workers have their own requirements for a certain level of personal protection equipment. So if you're a business right now and you are struggling to get personal protection equipment, this may include gloves, hand sanitizers, or masks, there are state and local programs that can help. If you're struggling to obtain these items, we would like you to reach out to our phone number, which is 801-525-5200. If not, we've also provided a link here, which if you call, we're just going to forward you to the link. So it might be easier to just go to the link. This link will take you to an assessment and an order form. In the assessment, it will ask you things like, well, what is your business type? What is your contact information? How many employees do you have? How many PPE items do you have currently, so that we know if it's urgent or if you're going to run out in a week. And then the order form is a request on what you're ordering. The next thing is these following things. There during in the guidance, there are certain times that you are required to wear a mask. And it does say, again, to reiterate, in areas where employees and patrons, it's difficult to maintain the 6-foot distancing. So in dine-in services, if your deli has seating, you are being asked to the employees to wear masks. In personal services, which I don't think it applies here, or gyms, but in retail, where we're talking right now, it is definitely encouraged for all of you to wear masks. And then in the high risk areas, so allow for remote work if they're employees of yours, if possible, or implement staggered flexible shifts, or, distance workstations, different things like that to protect our high risk individuals. Minimize the face-to-face contact. These high risk individuals you can see in the yellow are listed as individuals who are 65 years and older. People who have chronic health conditions, they may be living in nursing homes or long-term care facilities. There's a whole list of things on here on what high risk individuals are. And when we get into industry specific for retail and grocery stores, it does ask you to set aside some time for those high risk individuals to do some shopping. Other practices include avoid handshaking or unnecessary physical contact. Consider contactless payment options if possible, maybe even partitions from a cashier to a customer if possible. Again, non-punitive leave policies. So this really would encourage individuals who are sick not to come to work and spread the virus. And again, I already mentioned propping open doors if possible. Obviously, limiting unnecessary travel, maybe with employees following the CDC guidance. And again, when you read that guidance, as you are approving employees to do some vacation and traveling, there are areas listed that are considered high risk areas. And it is recommended in the guidance that if your employees travel to these locations, that they should then self-quarantine for 14 days upon arrival. So that's something to consider as manager and facility owners. So specific to industry, which is retail, including convenience stores, gas stations, and pharmacy listed in the guidance, recommended face coverings. We already went over that. Signage for social distancing. And again, this is page 12 in the guidance document, but signage for social distancing is recommended. So they're asking you at like a checkout or where a line may develop to have signage, maybe even have markings on the floor to limit people, from being in close contact. Assign an employee to disinfect carts and baskets regularly. The places I've been are doing a really good job at this. Make hand sanitizer available. This is upon entry at checkout stations, all those different areas. Set and establish time for high-risk individuals to do their shopping. It lists on here one-way aisles to support social distancing. I feel like this is something, if you feel like it's needed, to definitely do this, depending on how busy the store is. Deliver curbside when possible. Within a pharmacy, it specifies that waiving prescription delivery fees for high-risk individuals. In a grocery store, it says self-service restaurant guidance should be utilized. So within the guidance, there's a section for restaurants on self-service. So a staff member should be giving like the cup, the lid, the straw to the individual customer. Those should not be self-service at this time in your deli areas. And this obviously excludes produce. And then in a grocery store within the guidance, it does say allow for reusable bags. Things to remember as we move forward with these guidance and just the times that we're in is that we're still learning. We're definitely still learning about this virus and what causes it. And then there's currently no vaccine available to prevent the virus. the best way to prevent the virus is not being exposed, which makes perfect sense. So the way that you avoid getting exposed is staying 6 feet away, wearing a mask, not being around individuals who are sick, and then take precautions to the high-risk population. This this virus within those populations is clearly very deadly and is impacting that high-risk population heavily. And then individual responsibility, we really want to encourage individuals who are sick not to come to work. Don't come and spread the virus. We are encouraging our community partners like yourselves to embrace these guidance as well as implement them so that you can help prevent the spread as well. And lastly, we want to provide our contact information. So as Rob mentioned, and myself, I am the director for the environmental health. So environmental health's number is listed on this slide. I think a lot of you know us because you either hold a food permit with us, maybe you work with one of our counter partners for your meat permits, TFE permits. All those business questions and permitting are through our office. So feel free to call us if you have any future questions. If you have questions about somebody who is a positive case or somebody is saying that they are quarantined or something along those lines, we have added the nurses line here who can ask more medical questions. And of course, we've provided our link back to our website that ISA reviewed in depth, as well as showed all those resources, so you can print some of those resources out. This is kind of our new tagline or logo. It's Davis County, safe, smart, and strong. And honestly, we are so proud of the work that you guys are doing out there. I know you guys have implemented some amazing practices to help the entire community stay safe during this time. And at this time, I'm going to have Rob talk about this slide.
Perfect. Thanks, Rochelle, and thanks, Isa, for all your helpful information. I just want to reiterate what Rochelle said, that you guys have done a great job and working through not just the orange, but some of you were essential, so you were open during that time too. But this first number is my contact. It's my direct line for Davis County Economic Development. Please feel free to call me if you have any questions regarding workforce, regarding job opportunities, regarding financial assistance. I'm here to help business in Davis County, so please feel free to reach out to me anytime. This next number is for the Small Business Development Center. It's at Davis Tech College. Andrew Willis is the director of that. And he is there to help really just with small business, with business plan, with growth opportunity, any need that a small business has. Andrew's the expert in the county, so that's his direct number. And they received some financial aid from the CARES Act to increase their consulting capabilities. So they're looking to help more businesses. This third one is the Commercial Rental Assistance Program that the Utah State Legislature adopted. They provided $40 million to help offset some of the rental costs. Businesses can apply for up to $10,000. As of last week, of the $40 million, only $10 million was spent, so there was still $30 million available. And then lastly, we're part of the Northern Utah Economic Response Team. This was an economic COVID-related response team that was created between our county and Weber County. And that website that I have posted has a bunch of resources, not only financial resources, it also talks about some good news. So some of the corporate sponsorships and donations that have happened during COVID-19. It also has some job listings. So that's a great asset for businesses to go to for help and for further guidance. And then also just a quick reminder that this webinar is being recorded. So if you want to go back to it, and if there's something great that Isa or Rochelle presented, they're like, oh, what was that again? Feel free to rewatch this. We'll post it on the COVID-19 county website. And now it's time for the questions, which I don't see anyone has written any questions. So feel free to write them in the chat or the Q&A button, or also there's a raise your hand option. So if you have any questions you'd like to discuss, or also Rochelle mentioned some good news. So if there's some things you've been doing in your business that's worked well, now's the time to share that as well. We'll probably just wait like a minute. I know awkward silence is awkward, but so we'll stick to a minute. If you're typing any questions, I just want to also mention that we'll be sending out an evaluation form for this webinar. We would love to get your feedback on what information was helpful, if there's any other information you'd like to hear, and just some suggestions on how we can improve. As I mentioned before, this is a series of webinars, so we're looking to see if this is helpful and what other webinars we could host in the future. So just be looking out for that evaluation link. And it looks like Julia has a question, so I'm going to allow Julia to talk. So go ahead, Julia. You're muted, so you need to unmute your microphone.
Okay, can you hear me?
Yep.
Thank you. Because of everything that has happened this summer and so much has been canceled, many of my customers have nothing to look forward to. And I would like to put together an event that would, kind of take the place of everything else they're going to miss. And so I'm looking at hosting, I'd like to do 200 people a day, I don't know, in an outdoor type of venue. Is there any licensing I need for that? Anything special because of COVID that I would need to put in place? I have a bunch of questions about, do I need to sanitize everything after they leave? And who would I talk to about that?
So Julia, go ahead and call the environmental helpline. So I'll give the telephone number again, but it's the 801-525-5128. We have an environmental health scientist who is on office duty every day, so someone is available to answer all of your questions or a range of questions. In summary, though, for the individuals who are also on the line wondering wondering the answers, at this time, we're still not issuing mass gathering permits, which is large groups of people, and we are a little hesitant on temporary food establishment permits. But if you do not need any of those permits, and you would not for 200 people, then you do not need a permitting process, but we'd love to help you work through some of the questions on, I don't know what type of event it is, but making sure that spectators are seating 6 feet apart between households, encouraging symptom checking or with signage, whatever the event might be. If there's dancers or participants, they need to have symptom checks. So there's a large variety of different things and information that we can provide to you, which can be done through a telephone call or through an email. But thank you for the question, Julia.
Perfect. And then Blaine, looks like you have one as well. And if you're not able to speak, feel free to write it in the chat room and we could answer it that way as well. So Lisa asked, well, who do we talk to if we see a retailer not following guidelines?
Yeah, again, so the Environmental Health Division is going to be the ones addressing complaints. So feel free to call the number that I mentioned, the 801-525-5128, or we have some wonderful options online to submit a complaint or submit a question to the health department, and feel free to use those avenues and report to us. When we receive a a complaint, we will call the business, provide education, and investigate the complaint, of course. So.
Perfect. Thanks, Rochelle. And Blaine, we'll give you like another 30 seconds to type or do whatever. I'm going to lower your hand though. All right. This is from Blaine. Any suggested resources to help with disinfecting customers' items upon handling incoming, like in a jewelry store setting?
Yeah, Blaine, I think one of the main things that can be done in a jewelry store setting is ensuring that all of the customers upon entry use hand sanitizer, because then you know that they have clean hands before they touch the jewelry, and you're not actually having to sanitize the jewelry. Other ways you can do that is just letting the jewelry sit out for 24 to 48 hours without being touched. So I'm not sure how often individuals are touching each individual product, but maybe if there's a time in between touching it, that of course eliminates the need for disinfecting as well. Hopefully those.
What about, Rochelle, maybe you answered this, what about like if it's like at a jewelry store, if someone wants to come in to have their wedding ring cleaned like on the spot, what's something that they could do that way?
So in that case, what we would recommend is possibly having an envelope that the customer could place their ring into without having your employees actually touch the product. And then the employees who are cleaning the ring could wear gloves as they're placing it into a whatnot. There's a lot of ways to not have customer contact. And so whatever works best for the business, it's going to be case by case, but we're more than willing to brainstorm some of those ideas with businesses.
Perfect. And then Blaine has a follow-up question. Do we know how long we need to leave an item in a UV light box to disinfect it?
Yeah, so Blaine, it does depend on the actual, a lot of times with the products, you're not able to disinfect or the UV light cannot penetrate all of the surfaces due to the design of the jewelry. So I would there, but a lot of times the UV sanitation is recommended or shown on the manufacturer recommendation, but it's usually like 20 minutes roughly, and we can help you with that on which UV product you're using. And again, if the jewelry is flat, then that works really well. If the jewelry is not flat and there's areas that the light cannot penetrate, then it may not be able to be sanitized fully with the UV light. But again, using UV light is obviously encouraged because it is a step in sanitizing.
Perfect. Okay, if there's no other questions, we'd just like to thank everybody for tuning in. And again, just look out for that evaluation survey. And thank you for joining us today, and we hope you have a great night. Thanks so much.